Primary healthcare is a basic human right. But for millions of people in the deeply rural pockets of the Eastern Cape province of South Africa, even the most basic health services are exceptionally hard to access. Extreme poverty, exacerbated by the rugged terrain, lack of facilities and historic underdevelopment, means that even those with serious medical conditions often go undiagnosed and untreated. The Donald Woods Foundation is responding to this challenge with an innovative health intervention. It's Health in Every Hut program, which aims to map and screen every person in every hut in the Mbashe region, and if they find medical conditions in need of attention, they will refer people for treatment and follow-up care. Together with its national and international partners, including the Provincial Department of Health and the Eli Lilly Foundation, Health in Every Hut is now bringing health screening to thousands of rural homesteads, many for the very first time. The backbone of the Health in Every Hut program is our team of community health outreach workers who walk from hut to hut, covering vast distances every day, doing basic health care like taking blood pressure and glucose tests and educating people about health risks.
When we get there, we as the Donald Woods Foundation have our staff that will be doing testing blood sugars, doing HCT, that is testing HIV and AIDS, also blood pressures and weighing of the people in the communities as well as the children. We identify people who are seated at home, not knowing that they are sick. We get them with diabetes, very high blood sugars, and because Health in Every Hut has been to them, they are now on treatment and are very thankful about it.
We've got screening child that are visiting homesteads, screening the people, identifying the problems with them, and referring them to the facilities if they identify problems. Chows are going out with the laptops. They screen all those clients using the laptop with the application, DWF Impilo application. They come back on a daily basis with that information in the afternoon. We sync those computers into our server, make sure that all the information is combined into our server, and then we pull out that information and analyze it on a daily basis when they are away to the field. And then on Fridays when they come back here, we also plot all the homesteads on Google Earth, making sure that all the homesteads are reached on a daily basis.
After the original screening process, our team of embedded chows do regular follow-ups in all the households previously visited for screening. These chows live in the communities in which they work, which means they are able to build up close relationships with the people they monitor.
Presently, what they do, they follow up each homestead that was screened to check all the clients that we identified, whether they are started on medication or not, and also the measure, the blood pressures, if maybe like there are some changes on it, and also identify the ones that are defaulting medication, and also refer the ones that are presently defaulting the medication. I've got a team of 3 data capturers. We collect that data and capture it into our systems, and also pull out all the clients that are due to be seen on a daily basis by those embedded chows, because they've got the dates that they put to those homesteads to go to the facilities, and also make sure that all those clients, they've gone to the facilities if they are defaulting medication. The one that is done by embedded chows is the one of the most important ones, because we give them the list of the clients that they need to follow up, and then they come back with that information. We capture that information. That's why we see the impact and the outcomes of the interventions that we've done to the clients.
Since its inception, Health in Every Hut has expanded to cover an area of 200 square kilometers, and we are looking at increasing our area of operation even further. Screening and healthcare follow-up has also expanded to cover a wide range of conditions, including hypertension and diabetes, HIV, epilepsy monitoring, child and maternal health, and most recently, dementia.
The Health in Every Hut program is dealing with all the diseases, that is all the family issues, identifying child health, identifying maternal health, identifying NCDs. ARV program was working a bit different from that one, because ARV program was only focusing on ARVs, but now we're broad, we're focusing in all the problems we identify in those homesteads. That is all the clients that need to be sent to the facilities to be seen for clinical purposes.
Ndafika hapa ndingasasibani hayi kodwa nina nayibona senyuka kakhulu, nandicebisa into yokuba mandibaleke ekliniki. Impilo yam ndibonakala ibhetele kakhulu, mandisebenzise ezi pilisi.
La mantombazana nabatata abafikayo besuka kwaDonald Woods baye nabandinceda ukuba ke bebendikhuthaza okokuba iipilisi ezi ndizilondoloze ngokuzisebenzisa.
In addition to health screening, our CHOWs also help mothers to better care for their children and for carers and foster parents to access much-needed government assistance.
Baphinda bathi zindinyuke okwenzelwe certificate umntana enenene ndenyuka senza i-certificate yaphuma igrant yomntana phaa kuJanuwari.
Another aspect of the Health in Every Hut program is clinic support. We work closely with the Department of Health staff to improve clinic services through the mentoring of nurses, streamlining patient flow, and improving overall quality of care. This in turn helps the department to roll out more effective primary health care in the Mbashe region. Health in Every Hut is more than just a health program. Like all our other initiatives, it is about upliftment, empowerment, and restoring dignity. Our philosophy is to help the most vulnerable and at-risk communities to improve their own lives. By strengthening their access to quality healthcare, Health in Every Hut makes it easier for those communities to live more productive and ultimately more rewarding lives.